So this patient has about a grade 2 nuclear sclerosis, uh, and he has come for cataract surgery, and the case is begun by making the two side ports, staining the anterior capsule under air and viscoelastic going inside the eye. So rhexis marker, just giving a rough guide about the rhexis size. And this histotome is being used to make the rhexis. It seems to have been made a little shorter on the first rotation of the capsular flap, not exactly following the mark on the cornea, and hydrid dissection being done in multiple quadrants, making sure that the nucleus is completely free and viscoelastic go inside the eye, just removing some of the cortical matter that is there in the center. And now this, what you can notice is that I am using the chopper to go to the periphery, and without using any vacuum or any power, I am just pulling the chopper towards the center of the eye, where the phaco probe basically just supports the pole of the nucleus without actually going inside the nucleus. And this is a kind of a pre-chop. So without using any phaco power or phaco energy or vacuum, I have chopped this nucleus into multiple fragments, and then each of these fragments can be emulsified as is being shown. So this is a technique which has been popularized by Dr. Neto Pre from Brazil, and also you can see that I'm using the phaco probe itself to remove the loose cortical matter, and it comes off quite easily, and viscoelastic being placed in the anterior chamber to fill the capsular bag, followed by implantation of the foldable intraocular lens into the capsular bag. Now, since we did notice that the opening of the capsule was a little short or deficient, so we are enlarging the size of the capsule. So now we do have a good capsular opening with some overlap of the capsule over the intraocular lens. And now we can remove the viscoelastic from in front and behind the intraocular lens. So another technique that I have been using for a few months now is that I use the sharp edge of the intraocular lens to polish the posterior capsule. And you would see some fibers that are there behind the intraocular lens once the polishing is done. And I believe that this maneuver can reduce the incidence of PCO. Only time will tell. And then this case is done now, and one has to just hydrate the main wound and the side ports. So you can see that I'm doing that, and then I would also check the tone of the eye to make sure that I've done enough hydration, and then I loosen the speculum and then put in this moxifloxacin inside the eye. Thank you for watching.